And statistics show that, and that's all, sorry, later, but statistics show that of those babies who have a brain bleed with vitamin K deficiency bleed, a third of them will have permanent brain damage. Yeah, so some impairment, not necessarily really bad, but some permanent damage. So I push it. I mean, I tell them that I had a baby that had it, and it just really changed my attitude about it, because I used to be in that category of if all the babies are born low, then that must be the right thing. Yes, that's the norm. Yeah. But the thing that and this is one of the slides too, is that yes, there is this issue, but and if it's normal, that's fine. But it's real critical, and so when it is needed, it's critical. There may be a small percentage, but those babies are going to be, first of all, just be away from their mamas in intensive care. I mean, that's bad enough right there.
I had one brain bleed. And that was back before, when they gave us the oral that we were to give that.
That's so stupid.
Well,
We had, I don't know if y'all know the history about it, but we had a pediatrician was over our program for a short period of time. And she said she researched it, and that if you gave that injectable vitamin K, double the dose orally, that it was equivalent.
Because we're not allowed to get injections.
With glass.
That's why they.
Yeah, with glass shards.
Break that glass.
Cordy's here.
Yeah.
my client that had the brain bleed had 2 ampules of oral, and 6 weeks later had the brain bleed.
Really?
Yeah. Well, the problem is, I mean, the
Did
thing
they
that's good
sustain
about
an
it,
injury?
What's that?
Did they sustain an injury at that 6 week? Like, did they get bumped or dropped or something?
Oh, no, but
It's
all of her children have vitamin K deficiency.
Oh, wow.
Yeah, her
Genetic,
son almost
yeah.
died from a circumcision,
uh-huh.
and they didn't do vitamin K with him.
Oh.
And then the second one was the one I did, and so we did the vitamin K, like the health department said, because her first baby was born in Missouri. And at 6 weeks she had the brain bleed, so after that I got the injectable, and every child we did the injectable. She's had 7. Her last baby at 6 months he had a vitamin K shot at birth. At 6 months started getting bruises all over his head. We did the INR test, and Quest sent back, get this baby to the hospital immediately. And we gave an injection, and then they went to Kansas City, and he's on a supplement of vitamin K now for the rest of his life.
Wow.
Yeah, so that's why I'm vitamin K.
I am too.
Yeah, I mean, I tell them. It's serious. Let's see what okay. So this is when I need those things, although I'm dyslexic, so I don't really. Sarah Whitman has a book on it. Picture there. And it's really interesting. Yeah, she really covers all the research. I mean, and she covers those things that people say, like, well, if all babies are born with it low, then God didn't make a mistake, so that ought to be right.
Well,
It's not that it's not really that they're born without vitamin K. They're born without the ability to absorb it. Yeah.
And I've got so many
Which is
people that feel good about because they're doing oral vitamin K drops. But if they truly have the vitamin K deficiency, it's my understanding that doesn't work unless
Well,
they have
that's
the
not the
shot.
research. The research shows that it does, but you have to be sure and continue to give it.
Right.
The compliance thing is the biggest thing. And like in England, they were always doing the drops, but they had visiting nurses that came out and gave the drops also for those repeated doses. And that is in here. Let's go forward. So the reason that I included this talk with this conference is that they just came out with new guidelines, and that's on evidence-based birth. And she's got, I'm going to show her that thing that you handed me a while ago. There is a 40-page signature article. Yeah, that's the professional. If you have the professional, so
It's about that thick.
and there are 100 citations. That when Rebecca Decker does her research, she presents all of the stuff, and it's good. Yeah, and if you in the beginning when she first came out with it, I thought, well, I'm going to read some of these citations and just let her read them. They are so
She'll
difficult
give
to
me a
read.
nice bullet points that I need.
She does all, it's
She
all
does
good.
amazing.
Yeah, she's good. She, you know, of course, we can trust her more because she was a home birth midwife, home birth mother. She was a nurse and then got her doctorate in medical research, so she knows her stuff. And so Sarah Wickham says, it's your baby, it's your decision, but I don't know, I feel a little invested in our babies. Our babies.
Believe in informed consent.
Yeah,
So informed is the big future.
yeah, that's it, yeah,
And your information can be biased.
yeah. See, I think all my babies go overdue because I went so far overdue. I think we generate onto our population, yeah.
I know moms would hate you for that statement.
Yeah. Well, I'm at 43 and 5 with Alex.
Did you have an early ultrasound though?
37 years ago?
I know. To me, that's the difference, is back
Yeah.
then, we didn't have those early ultrasounds.
Yeah.
And those are,
Yeah.
you know,
Yeah. But yeah, we had 6 babies to deliver and he had to be the last, not the first. We did 6 babies in 10 days and he was the last. There's a picture of me like this in front of a woman who's pushing her baby out.
oh, that's good.
Okay, so it's called K because it comes from coagulation and stirring. It's an essential part of our necessary thing for our body, so that's why it's called vitamin. It's fat soluble, really important factor that we have got to be sure that the baby has just eaten before we give it to them. So at the birth, make sure the mother has nursed that baby and that it's latched. And then you give it, yeah, and you've got to tell them that when they're given the next times that they give it.
Talking about the oral.
The oral,
Okay.
yes,
And
yes.
you get yours from in this here?
Yeah.
Amazon. Same kind.
Okay, and so this is just a coagulation. Platelets are broken down and these little pieces are pulled together by the vitamin K. The vitamin K helps us to manufacture our clots. That's what's so important. 90% comes from vitamin K1, which is in our food. Only 10% comes from the bacteria in our gut, in the baby's gut. Yeah. And oils are a very important part of it. Oh, so the reason that they like their injectables is because when they inject it into that muscle, it stores there and releases over time. It makes it a time-release substance. And so that's why it's real important that we do the follow-up doses. You'll see on the statistics, it's amazing how if you just do one at birth, it's not going to protect the baby as if you do it over time. So they named it vitamin K deficiency bleed instead of hemorrhagic disease of the newborn because other than newborns can get it. Yeah, so if it's outside of the newborn period, that really doesn't apply. So we call it vitamin K deficiency bleed. And there's the timeline. They discovered it was described in 1894. So we've known about it for a long time. Yeah, and they came up with the vitamin K in 1944. 100 years. Yeah, a long time. We should have figured it out by now. So there's 3 types. The early onset would be, and I found this real interesting. Notice that the numbers are all real overlapping. So some people want to say there's only 2 types, and really what we're seeing mostly is the classical. The early is when the mother has been on some drugs, and the baby can have it in 24 hours. Our baby was about 5 days, I want to say. It was actually Rebecca's client, and I was at that birth. And then the mother called me, she said, the baby's got a nosebleed. Well, take that baby to the hospital. I'll meet you there. It was delayed, which is really sad, because she called a nurse practitioner friend of hers, and the nurse practitioner friend said, yeah, babies can have nosebleeds.
Oh. I'm
So it's about 12 hours before she took the baby to the hospital, after having had a nosebleed.
That nurse practitioner is probably used to all babies having the vitamin K injection though, so they're dealing with other kinds of
Yeah.
nosebleeds, not associated
Yeah,
with that.
yeah. Plus, newborns have nosebleeds.
Yeah, so that says vitamin K doesn't work for a mom that has antibiotics, so group
That's what
strep
it-
moms.
That's what Sarah
Wow.
Williams book says. Yeah.
So what we do about that?
Give it another time. Just keep
Wow.
going. Yeah.
Huh.
And then so most of these bleeds can be in the skin, in the gut, from the nose,
From
and from
circumcision.
circumcision wounds. Yeah. Then there's late onset that can go up to, 4 to 6 months. Well, that's a long period of time, but then some people want to say 2 to 24 weeks, the dangerous bleeds, 8 days to 6 months.
That lady's last baby was 6 months. He was
Yeah.
6 months. And
Yeah,
there was
go on.
little,
Yeah.
just little bruises all over his head.
And one of the big things that they want to say that giving every baby the shot for that we miss is the gallbladder disease. Babies with gallbladder disease will have more of an issue with it. What's the treatment? Give him vitamin K. I mean, that's what they did with our baby. He got to Children's, they gave him a shot, the bleed stopped. But now he's got collection of blood. Some of them have to go through brain surgery, drill a hole in their head to drain it. Yeah. And they spend 4 weeks, at least 4 weeks in intensive care on severe bleeds. So intracranial hemorrhage is the most complicated of the bleeds. 30% of the time, that's what it is. And see, some need brain surgery. About a third of them will have long-term brain damage. Yeah. And here's just a guideline thing. The studies were done. We found it. Yeah, in little chicks.
You're talking about chickens or little girls?
Chickens. Yeah. And in Sweden, no, that's not the studies. In Sweden, they started researching it, and they saved lives. Let's see, they saw a 5-fold reduction when they did give the injectable, and they figured they saved 160 babies from dying from it out of 100,000. So the American Academy of Pediatrics recommends the shot, of course, and it wasn't until 1999 that they changed the name to vitamin K deficiency bleed. I still say hemorrhagic disease in the newborn half the time.
Did they require it in 61, or when did they start?
That's when they recommended it, yeah.
Right.
I mean, and
But I
pediatricians
wonder
pretty much do
When
it.
it started,
What
when they
age
were
is it?
routinely giving it,
Yeah,
just curious.
yeah. So that would be our kids, not us.
It would be
Well,
me. I was a 63. I don't know if they gave it back then though.
Yeah, I was a
I
51.
don't either, mine was 70, so we probably didn't have it.
Okay, so I like this slide a lot. Okay, so no vitamin K in Europe, the stats were 4 to 7 will get it. 4 to 7 per 100,000 get the vitamin K deficiency bleed. If you give one dose, 23 milligrams orally, then you lower that number maybe down to 1.4 to 6, but it's, one dose is not much different. Yeah. So one dose 3 times, one mega oral 3 times a birth, so 3 milligrams at birth. And then 1 week and 4 weeks, you drop it down to 2.6. Okay, and look at the next number. Say, when you give 2 doses, 2 dosages, same results. It's 3 doses.
3 doses,
Yeah.
I should know.
Yeah, so you give it 3 times. It's the birth, 4 to 6 days, 4 to 6 weeks, it drops it down to 0.9. I mean, that's a number I can live with.
You did.
Yeah, and then but you can also do it 1 milligram every week for 3 months, and it takes it down to the same number. So it sure seems like the 3 times is the thing to tell the ladies to do. If it's the exact same number, then I tell them,
You're gonna send these to us too, right?
sure,
It's in-
Please.
it's,
sure, sure,
It's in here.
yeah.
Oh,
And
good.
Oh, yeah.
Oh,
that's
good.
right.
Oh, yeah.
Those stats are-
Yes,
yeah.
so I included that handout. That's the handout that I give to all of my clients.
Yeah, I didn't
Yeah,
get it.
and she says 3 times that, 2
Yeah,
milligrams.
it's thing.
But, we don't,
Yeah.
when we were following, I don't know what protocol it was we were following before, it said 4 milligrams at birth, and then 2, so 4 drops at birth, 2 drops,
Weekly, wasn't it?
Yeah.
I think space birth is where we got it.
Until they,
And then space birth came out with that, unless they got it from somewhere.
yeah.
Yeah. Is all this right here from zero?
No, this is the
No.
new evidence-based birth.
This is
Handout.
on the handout. This is what Rebecca,
I missed that.
Mhm. It's in your
it's
packet.
actually,
I got it.
it's, those stats are from Sarah.
Okay.
Oh,
So,
okay.
so I'm kind of going back and forth between the two of them
Okay,
on what I'm presenting, so all these are oral.
yes.
Yeah, but, so the point being, the last line, if you give them the shot, it's still, they still have it some. So they want to say pretty much that it does away with vitamin K deficiency bleed,
Doesn't.
but it doesn't. There's still some will have it even if they have the shot. But 0.4 to 0.9, is that much difference to worry
Pretty
about it?
small. I mean, it's half, but it's still very, very small.
It's just the difference of avoiding the other ingredients in the shot.
Right, right.
Yeah. For you, hospitals do that. You can hold that. Yeah. All depends on what we try. It depends, it depends on what you find you can. If those, if you're gonna get the parents to really do the oral, then it's close enough. Yeah. But are they gonna remember?
Just do them in the hospital, because they'll lose a lot of follow-up.
Yes, yes, that's why they do the shot.
Yeah.
Plus, the other thing about the, listen, sorry, but the other thing about the shots,
Yeah, the freezing.
the other thing about the shot is that, what was I gonna say?
You're talking about the
Well, it's a
shot.
one-time
Oh,
deal. It's-
No, is that there's not a dose, there's not an oral that's approved. So as we're doing these oral drops, you know, that's really not a AAP approved.
Which we've been telling the health department for 20, 30 years.
Yeah, yeah. That doctor who found that double dose is saying it's not, there's no research on it at all. I could not find the research that she based that on.
All
I
I've
just
ever
said that
found,
exists.
since moving here, all I've ever found, and nobody at ADH was sending me anything, but what I found was an adult cancer research where they took 2 doses of the injectable and took it orally, but it was on adult cancer patients.
Yeah.
And that's the only research I can find, and if they're basing that for our babies,
Yeah,
that's insane.
not quite the same thing, is it?
Right. But so a question then, so for, cause I haven't read all the way through my Sarah Wickham book.
Mhm.
When it talks about the oral, it's talking about the oral that you can find out there, not our injectable given
Correct.
orally. Okay.
Yeah, no,
I figured so, but
She's
I wanna
talking
make
about
sure.
BioK Motion.
Okay.
Which is the only one you can get. Well, there's another
There's
one. Have y'all
another
seen that other one that looks like a tincture?
Yeah,
It's
it's
a
a
bottle.
bottle stores. I have some people who use it.
Yeah.
I just did that, okay.
But see, the BioK Motion is in an oil suspension, which
Mhm.
helps it absorb.
Sunflowers.
I like it.
Yeah.
Is that what's in the
Remember
other?
Megan's baby is allergic.
To sunflower,
Or
okay.
whatever oil is in
Uh-huh.
Bio-K.
It's something seed oil.
Yeah.
So all y'all are just not using the one in the health department's bag, you're just ordering from an online source to get the oral.
The midwife supply companies have it. Yeah. Which I guess is the only place you can get it.
Amazon. I've had
You have seen,
You can get it on
on
Amazon.
Amazon, yeah.
I was getting the injectable without preservatives,
Where were you getting it?
from the pharmacy,
Okay.
and that's what most, it's like, it's gone up to like $50 a shot.
Yeah.
But
Do you need?
And what did they pay for the
Sometimes-
BioK Motion?
it's like 30, I think.
Yeah, it's not cheap
Yeah.
either.
what'd you say?
Can you walk in and get it, or do you? need
Oh,
to-
no, it's a prescription. And, but I have a CNM that can
Yeah.
order it,
Okay.
and,
Okay.
I
Cindy
introduced
can
it
get
to
anything.
the pediatrician at the
Thinking
hospital,
about-
because if I have a transport, they don't want their vitamin K because it's got the aluminum in it, so
Yeah.
they'll decline it.
Yeah.
But she goes crazy if they don't get their vitamin K, so I told her, I said, I'm gonna just tell you, you know, this is what they have, and we'll just do it behind your back, you know, and the dad can guide him to give it. And, so she ordered some for the hospital, for people that want some without.
Well, that's nice.
That is nice.
Yeah,
And how much is it then?
I don't know what they charge for
Well,
it.
if the hospital hasn't got that, insurance pays for it.
Yeah.
But, I mean, maybe.
You can pay for it, you know. But she was impressed, and she said, well, I'm gonna get some for the people that really, that, they care about that, and then they don't
Well,
have to
she's
do it.
more likely to get people to have that shot.
Oh,
So it's good
oh,
that she's
exactly.
thinking
Because
that.
that is
Because those
what
other
the goal
ingredients
is
are
get
where
the
the problem
vitamin
is.
K
Like,
in
they don't want
baby.
those other ingredients.
Yeah, that's the number one reason that they see people refusing it. But they don't offer the option. That's
Heavy
the
right.
thing. Yeah.
Did this indicate that if they got the shot at birth, or shortly after birth, that there's no advantage to taking something orally over the next few weeks?
Correct, because it's going to be
Stress
released,
is
yeah,
affected.
that it forms a depot in the muscle and releases over time. Yeah, which is a good thing.
But you gotta watch those other ingredients in the shot unless you get the special one.
And one of the things that we see is that the peds will not do circumcision without it on board. Yeah. they
Doug
just-
Downs will up
Well,
at
good,
Seymour.
I mean.
Doug Downs at the Amish clinic in Seymour, he'll do it.
Yes, well, most of the people go to children's to have that, they absolutely, and if you tell them that the baby already had the oral, they're still going to have a shot.
Yeah, Northern Arkansas is the same. If you're doing an oral, then it's, I don't think you can find somebody who's gonna do circumcision.
In all of my reading, I've not seen anybody say anything about an overdose of it. Yeah, so,
That's good.
yeah, so I guess that's an okay thing.
So if you go to get your circumcision, they're gonna give an additional shot.
Well, if you've already given the shot and that's recorded in your chart.
Oh, yeah, if they have the shot.
Yeah.
But not if you did oral.
Right, yeah, because there's no guidelines for them, they want to see it in writing. And you,
But since what you all get in Arkansas is the injectable, you're just supposed to administer it orally. In fact, you aren't the one that administers it. Does it depend on how it's charted? Like, you're gonna chart the injectable vial
we're going to
because
try that
that's,
the dad did it.
that's what the charting is going to say that they received, because that is the product that they received. It's not gonna say that they received oral drops, it's gonna say that they received this product. I'm not telling you what to do, I'm just saying.
It needs to be defined.
Right, like the product that they received was the injectable form,
Is
that's
that
what
not-
they received.
Is that not,
I don't know.
yeah.
Well, then they ask
And
where,
they want to know even the number on it and
Yeah.
what dosage and all that.
But what she's saying
but they
is,
also
we
want to know
charted
where
that
it
they
was
got
injected.
that. We're
And
charting
we
they
have to
got
say
an
it was
injection
oral.
and they didn't.
No, you're charting that they received the injectable,
Right, that's what I'm saying.
not that they received an injection.
That's why
I
we
just,
did.
but my.
Yeah.
it's a game of semantics, I'm just throwing it out there.
And it's all in the words.
Yeah,
And that's how they take it, it's all in the words.
Yeah, it's a game of semantics.
The rules say exactly this, and that's exactly how you do it, you can't take this little variant, yeah, so you
Yeah.
have to use just those words. But, is
Given
it
or-
vitamin K one that says recommended? Several of those for right after the birth say recommended, it doesn't say required.
Erythromycin is recommended. We do the incident report on vitamin K.
Okay,
No, you don't have to.
she knows, because she doesn't.
We've been
can try
doing
to
it,
do-
though.
No, I know,
It's
most of the
fine.
midwives in the state have been doing it. You don't have to do an incident report, you simply have to show in your chart that you educated them, read that rule. It says you have to educate them, it doesn't say anywhere in the rules
On
that
the
you have to
vitamin K,
give it
that's
to
okay.
them.
Yeah,
You have to chart if they,
It-
if
it's
it's
all
on
in
it
the
or
words.
consent to it, and if you're giving it, you don't have to do an incident.
well, they let us
report.
administer some meds, there's one
Yeah,
that they
yeah.
changed to.
I mean, I
And
would
then should be
specifically.
designated as
The
the
new rigs, or
Oh,
is that in?
that's like
and
the
somebody
high.
10 years ago.
See, that's not, they did, we've been trying to change that for 10 years, but that's still sitting
And
on
she said,
someone's
no,
front door.
show me the page. Since I can give it.
Okay, so at birth, babies are born with
I
low
think it's around
levels.
28 weeks where you have to educate.
The lowest is at day 2 and 3. So they do have some, but it goes lower. And low compared to what? Low compared to adult levels? You know, maybe that's obviously the right number for babies if they're all born low. Vitamin K1, very little transfers through the placenta and very little transfers through the milk. But breast milk has very little, but all babies who had vitamin K deficiency bleed were breastfed. They're not any that were formula.
Because it's in form.
Well, then,
Because it's
yeah.
Yeah.
So do we make it?
Okay. So, why some refuse the shot? Just it's not necessary. You know, babies have it in low doses. just lack of knowledge of how important it is. And the correlation between that product and vitamin K deficiency, they say a lot of people just don't understand that or not talked about at all, you know.
Challenges their religion.
Right. Yeah. Concerns about preservatives, you know, that's a big thing for a lot of our clients.
And the metals in them.
And we're gonna see what's in it here in a minute. And that the clinicians don't offer an alternative. You know, if you say, I don't really want that injection, well, too bad. Because no oral is licensed in the United States, and they don't want to talk about it because it might initiate more refusals. So they want to say, well, we don't really need it because the baby didn't have a traumatic birth. The baby had an easy birth. Doesn't have anything to do with it. Doesn't have anything to do with it. Poor nurses are more at risk, so they're not getting at least what's in breast milk. And delayed cord cutting has nothing to do with it because it's not in the placenta to start with. Little vitamin K is in the cord blood. It doesn't pass across the placenta, and taking it extra in pregnancy doesn't help. Risk the shot. The parents will say, "Oh, well, there was a link to leukemia." There's no risk of cancer from it shown. And then the gallbladder disease is a problem because they have a hard time absorbing their fats. So if it's a fat-soluble product, then they're also not absorbing the vitamin K. Here's ingredients. Okay. So preservative-free version has the vitamin K1 in it. It's got polysorbate 80, which of course is an issue for some, and it has propylene glycol, which is a big problem for some. And that's in the preservative-free. Yeah.
Isn't that antifreeze?
That is antifreeze. Yeah.
And it comes with a black box warning.
But the black box warning is not really that big of an issue. If you read what's in that black box, it's not so much. It's you know, the severity of the black box depends on where they have it in, and it's way down at the bottom. So it's like, yeah, I didn't write the slide on it. But some, so from only an IV form of vitamin K, not from an injection agent. Yeah.
And I would like to add to that too, that's when they use the injectable form in the IV, because sometimes you can cross over medications when you're in a hospital setting. And it's for people that are on blood thinners. That's the population group that has seen that.
Yeah, that was on that
They're
first
not
slide.
newborns. They're not newborns receiving the injection.
Right.
It's people that are on blood thinners that are having an emergency, so they're being given the injectable form because it's what's available through an IV. And they're the ones that are having bad reactions.
I have a picture of that the preservative free that the hospital got. You know.
Yeah, so we can print that off. You can actually,
We'll need a copy of that.
yeah, you can actually print from your phone to my printer.
You have to be hooked up to Wi-Fi.
Yeah.
Yeah, you have to be.
You just have to know.
We can do it when we're done.
Yeah, okay,
already.
we'll do that. Let's not forget them, because I will.
Okay.
So, vitamin K is fat soluble, you give it after a feed. If they spit up, you give them another dose. Yeah, so, because, you know, at birth, they're half of it's getting out, and I always say, oh, good, we gave them the right dose. No, give them more. And those repeat doses are critical. If they don't do that, you see what the statistics do. It takes them way back up to the top. There's the vitamin K lotion. And it has gum, arabic, and sesame seed oil.
It's
Yeah, not
sesame.
Her baby's allergic to sesame?
Yeah, we had to give her the tincture one from your birth bag.
Yeah,
Well, they know the baby.
Yeah, I want to know that too, how'd they know that? Her previous kid was allergic, so she said, I'm not gonna,
Yeah, no, thank you.
yeah.
To Hunter, who's due before very
No,
long.
it was Megan, her husband's the chiropractor.
Megan
for the
Davis.
head.
Yeah, Daniels.
Yeah.
Yeah, I remember at her birth, they had a different one.
Yeah, okay.
That's a very happy ingredient list.
So if all babies are born with low vitamin K, there must be a reason. But there might be, but no research is done. There's no research to show why the baby